Hi, everyone. It's Alex Savage from KTVU Fox 2 News here in the San Francisco Bay Area. And along with testing for the coronavirus, one of the other key tools to helping slow the spread across the country is contact tracing. Joining us now to talk more about this very important work is Karen White, who is the project director of the Virtual Training Academy at UCSF here in the Bay Area. And Karen, you and your team train contact tracers all across California. First off, describe to us what contact tracing is and why it is so important.
Yeah, so you kind of started with testing, which is all a part. So there's sort of four pillars. What we're trying to do is really contain the disease to the greatest extent as possible into isolation, to self-isolate, so that they don't come into contact with anyone and expose them to disease. And as you get these positive people, you want to call them and figure out who they might have been in close contact with. And then the contact tracer would call those people, tell them that they've been in close contact with someone who tested positive for the disease. And then you want to get those people to quarantine as quickly as possible. And then you also want to get people to test. So it's sort of this containment. So quickly as you can, get the positive people into isolation, identify who they may have exposed, get those people into quarantine, and get them tested to see if they do turn positive and need to isolate. So it's sort of this kind of containment box with these pillars, which includes testing and contact tracing and case investigation.
Yeah, you need all of those tools at your disposal to try to slow the spread. So at UCSF, you have a virtual training academy, as we mentioned, to train people to do this work all across California. You've trained thousands of people already. This is a partnership with the California Department of Public Health. Well, what does it take to teach somebody how to be a contact tracer?
Yeah, so it's the Department of Public Health and then also UCLA, so make sure they're a partner of ours as well. And so what it takes, so we're training the case investigators and the contact tracers, the case investigators who call the positive cases and elicit the contacts, and then the contact tracers who call all the contacts and talk to them about quarantine. And so our training is about 20 hours and it includes some online work in advance and then some didactic training around certain things. So the epidemiology of the disease, how it's transmitted, the incubation period, all that. It has some training around quarantine and isolation and how you identify the dates and the exact days and times people would need to isolate or quarantine. But a lot of it is actually practicing skills. So working with the actual scripts, so these people will be using kind of, roughly using these scripts that have been developed by the California Department of Public Health when they're calling people. So working through those scripts, but how to motivate people, like sort of motivational interviewing techniques and health coaching. So sort of we have, what makes it a little bit unique is that we give people the opportunity, we break them up over Zoom into smaller groups, and we give them the opportunity to practice the scripts and practice their interviewing skills during the training as well.
It seems like that is probably one of the more challenging aspects, or maybe the most challenging aspect of this kind of work, is that you're having really difficult, serious conversations about people's health and the health and well-being of their loved ones and their friends, and you're doing that all over the phone. So it probably feels a little bit impersonal in some ways, and you're trying to get them to do something really important, which is to isolate themselves to protect others.
Yeah, no, that's not easy. That is the most difficult part of it. So we really try and train people how to be, sort of good listeners, how to ask open-ended questions, how to sort of communicate and make sure someone, because you're catching them at a time and you're giving them a ton of information, and you want to be able to kind of repeat back to them, make sure that you work together on a plan. So what's it going to look like when you go to quarantine? Do you have enough food for 14 days? Do you need medication? So really kind of talking through all those questions. And a big part of this that I forgot to mention as part of the containment is actually being able to offer some social services to go with it. And it's going to depend on each local health jurisdiction and what they can provide. But most are able to provide isolation hotels, so if someone's not isolated at home, they don't have a bathroom, they're in, high density housing, maybe they're homeless, to be able to offer them a hotel. So this is something that the case investigators and the contact tracers do. If they don't have enough food and or supplies of essential supplies, cleaning supplies or medication, then we like to be able to provide referrals to get those services as well. So
the typical period of quarantine that you recommend, is it still 14 days, or did I hear that it's now down to 10 days for recommended?
No, the quarantine period is still 14 days from the time of close contact. The isolation period, is a little, so it's 10 days from the time of symptom onset, assuming that you feel better and are fever free for at least 24 hours. So it could be longer if you have a more severe illness.
I would imagine too that in a lot of cases, especially if you're talking about essential workers who are still on the job every day, trying to bring home a paycheck and trying to make it through what is a very challenging time financially for so many families. In a lot of cases, it probably doesn't feel realistic to someone to go into quarantine for 2 straight weeks and not be able to go to work and not be able to see their family.
Yeah, it's a tough message, but it's something that we really, really need to get people to do to stop spread of the disease. So we try our best to convince them in all kinds of different ways and make it easy for them by providing services. We also send them an official letter from the health department saying that actually they need to be in quarantine. It's actually mandatory. I mean, we as contact tracers don't sort of go out there and enforce that, but it is a legally enforceable mandate in most jurisdictions. So we provide them official letters saying that they need to quarantine for 14 days.
Who are most of the candidates who are becoming contact tracers in our state? I think you were telling me that mainly it's government employees, but you probably have folks from other backgrounds.
Yep, for sure. I think initially and still the majority. So a lot of them are state employees that are, have been doing other work. Some of them are from the state health department, just other divisions of the health department. And some of them work in departments like the DMV or, the roads and services.
Caltrans, yeah.
Caltrans, we've got Caltrans
Fishing
people,
game,
DMV people, fishing game, from all state departments. And then within the local health jurisdictions, they can also send people, and in some cases, those are city workers, librarians, or state attorneys. More and more, we're trying to encourage, in some cases, they're just volunteers, people who have an interest in doing this work. We're trying to encourage other community-based organizations to send people to the training as well, because we think it's really important that, obviously the hardest hit communities, sometimes the Latinx communities or the Black communities, or, even, other communities, that you want to get people from those communities talking to the people in those communities. We think it's a more effective conversation. Clearly there's language issues, but there's also sort of cultural issues that it makes it much easier for folks from that community.
Yeah, that obviously makes a lot of sense. Are there certain qualifications, certain criteria for someone who might want to to apply for the program or to be a part of a contact tracing effort in communities? What would be the steps someone would take?
Well, I think there's some local health jurisdictions where you can actually, there's Santa Clara, there's a few where you can actually go online and volunteer to do it. And I'm not sure what their screening process is. The state is still using state employees, but I mean, I think what makes a good contact tracer is just someone who's empathetic, who can listen, who, is good on the phone. I think that's a lot of it. You can learn the skills, you have scripts, you have technology where you're entering the data, it kind of prompts you to say different things. So I think the most important thing is sort of the ability to listen and be empathetic and kind of relate to a person that may be in a bit of a crisis situation.
I was curious about this. I'm curious how typically, on average, how many contacts are you reaching out to on one positive case?
Most cases have somewhere between 4 and 5 contacts. And then we talked a little bit about, so if you're a case now that people are, shelter in place is lifting and people are actually going back to work or potentially back to school, and, unfortunately to, maybe sometimes a party, sometimes you'll reach a case who's been in a different, either at a workplace or at a party or, potentially, coming up at a school, and those sort of get turned over to people who are more adept at outbreak investigation. And that's another area we're going to try and train more people up, because, there are people in each health department that are really good at this, disease investigation specialists, but there just aren't enough of them to go run down all of these potential, settings that an outbreak could occur in.
All right. So I guess another question too is the situation we're facing here in California, and that a lot of other hotspots are facing around the country right now with this big surge in cases. Does it make it more difficult to do effective contact tracing when you have this kind of high level of transmission, the high level of positivity that we're seeing right now here in California?
It really does, because speed is of the essence, clearly. And when you're not able to call everyone, or you're not able to call everyone in a timely manner, or you can't get test results in a timely manner because the volume's gotten out of control, it really kind of reduces the effectiveness. So in San Francisco, we reached a point where we have these kind of high goals. 90% of all cases need to be contacted within 24 hours and, able to effectively isolate. 90% of their contacts need to be contacted within 24 hours and told how to effectively quarantine. But when you start getting high volumes and you don't have enough people to make all those calls, or your test results aren't coming in for 6, 7, 8 days, then it doesn't kick off. You need the positive test result to kick off the case investigation, to kick off the contact tracing. So all of that time gets spread out, and then you've got more time for these people to be out potentially exposing other people before they get these messages. So yeah, these surges make it more difficult for sure.
And also, the other issue that we're seeing across the country, as you just alluded to, is this these lengthy turnaround times for test results. I mean, like you said, when you're talking about not getting results for a week, potentially even 2 weeks, we're hearing in some cases. You guys are running into that, where you're hearing that folks, that you're finding out that they're a positive case, but it's days, weeks after the fact, and then it's so much harder to go back, work your way that far back and figure out all the places they've been. And with all the
and given that,
it's almost
and given that 40% of cases are asymptomatic, don't have any symptoms at all, then maybe you've been exposed and maybe you go get a test to be safe. You don't get your test result. You're not going to be maybe as careful until you have a positive test result and you need to self-isolate. But if that positive test result takes a long time in coming and you don't have any symptoms, it's almost impossible to get people to be, as careful as they should be during that time.
So one of the keys, obviously, is to bring down that positivity rate in a state like California to make your work easier to do.
Yes. Yeah.
At some point, I remember reading about some of these contact tracing apps that were in the works, Apple and Google, and I'm sure you read about some of the things they were working on, where you would have your Apple Watch, let's just say, on, and if you had contact with someone for an extended period of time, that you would get an alert, and so you'd know that you potentially were exposed. Is any kind of that technology being used in this kind of work, or is it pretty much still old-fashioned human beings picking up the phone, making the phone calls, doing the investigative work?
Yeah, it is. It's pretty much that. I mean, I think the place where those apps could be useful is when a case investigator maybe calls a case and says, hey, who were you around in the 2 days prior to symptoms until, current, and maybe they could look at a phone app and kind of recreate their steps or something. But I think a lot of those apps need to fit within a system. Like, so, that people need to know, like, oh, you get an alert and it says I've been in contact. Like, so then what? So what do I do? And, I think it needs to be within a system, sort of the public health system, where you understand, okay, well, now I know I need to quarantine for 14 days and someone's asking me if I need services in order to be able to do so. So I think those technologies may have a place, but I think they need to fit within sort of, the public health system and current efforts.
One other thing that occurs to me in terms of helping contact tracers to do their work, obviously you're sort of, you're having to make these kind of cold calls to people, right? In this world we live in now, most people, they pick up the phone and they see some random number is calling, and it's like, forget that. I'm not picking up that phone call. Is there a challenge in getting through to people? I imagine there is, just getting them to pick up the phone.
Well, there is, but in the Cal Connect system, the current technologies that's been using, it actually comes up as, let's see, it says COVID California. I can't remember the exact term. I can,
Okay.
but
and it will give you something, an official title comes
yes.
up when a contact tracer is calling. Okay, good.
Yeah. So you can see it. And there's also, I know the governor has a lot of communications efforts going out there and trying to get people to understand, hey, pick up the phone. This is the contact tracing case investigation effort is, California connected, all that. So I think there's lots of efforts to get people, educated around the fact that, they may receive a phone call and that it's legitimate. So hopefully between that and the ID that comes up on the phone, people will answer.
Yeah, absolutely. So you were telling me that you have at least, you've trained through the virtual academy between UCSF and UCLA. You've trained at least 7,000 people to do contact tracing work across California. But as we continue to see the surge in this state, where do you need things to be? Where do we need things to be in terms of the number of contact tracers who are doing?
Well, I think the number does need to go up. So it's been just over 7,000 plus additional that have been trained directly by local health jurisdictions. I think that's one piece of it. The other thing we're finding though is that in some cases we have trainees that have come through that are still waiting to get deployed. So it's not just the people coming out of the training academy, but it's making sure that the capacity, the absorptive capacity to take these people on at the health jurisdiction so that they've got the technology deployed in a way that's usable. They've got managers there. They've got, ways to, get these people up and running and onboarded. So I think it's both not just pushing people through the training academy, but also working with the health jurisdictions to create a platform in which these people can do the work. And so that's happening, and we're working on that. But that's also one area where we need to,
Okay. Well, if someone is interested in doing this work, as you said, there are places and ways to do it on kind of a volunteer basis after going through the training. So I'm sure there's a lot of folks who would.
Yeah, I would say contact your local health jurisdiction or look on the website and see, if they're taking volunteers for these positions.
All right. Well, as we talked about at the top of the conversation here, Karen, I mean, it's really, like you said, it's one of the key pillars to controlling the spread of the virus, right? I mean, you're talking about testing and doing testing in an efficient and timely way, and then doing the contact tracing and finding those people quickly.
Yes. Yeah. So it all has to happen together.
Yeah, and it's got to happen in
and time is of the essence.
And time is of the essence, of course. Well, really appreciate you sharing more about this work. It's really fascinating, and it's so important to this fight we're all in. Appreciate your time, Karen White from UCSF's Virtual Training Academy, where you train thousands of contact tracers to track down people and their contacts who may be positive for COVID-19. Thank you for talking to us about the work today. We have more information up at our website. Thank you. We have more information at our website. That's coronavirusnow.com. And I'm Alex Savage from KTVU, Fox 2 News in the San Francisco Bay Area. I'll talk to you next time.